The Biomedics non-invasive venous testing technology is designed to detect chronic venous insufficiency, or CVI, quickly and easily in a variety of frontline care settings. While in the waiting room, patients can complete the brief patient questionnaire supplied with the testing system. The physician can review this questionnaire along with the patient's background and risk factors in order to assess whether or not non-invasive testing is necessary. When the venous exam is scheduled, it's important to let patients know that they cannot smoke for 30 minutes prior to their appointment. Because pressure cuffs need to be applied directly to bare legs, the patient should also be informed to bring their own clothing that is suitable for the test that is not constricting, such as gym shorts, when the appointment has been confirmed. You may wish to enter any available demographic information ahead of time. The test takes about 10 minutes for beginners and those new to the system. When a patient has changed to appropriate clothing and is ready for the exam, they should rest for 3 minutes in a sitting position on the edge of the chair. Click Perform New Venous Test and document any required demographic information. Remember to enter the patient's insurance, referring physician, and all physical signs and symptoms. Under the Physical tab, select the CEAP classification for the right and left leg. Next, go to the Test tab, then click Perform to begin the test. The patient should sit in a stable chair and should be sitting towards the edge of the chair with their legs at slightly more than a 90-degree angle. With the testing leg slightly further forward, have the patient rest in this position with no movement before the beginning of the test. Plug the hose into the port for the venous sense cuff. While the patient is resting, explain how to perform dorsiflexion. Demonstrate this movement slowly to the patient, but do not allow the patient to interrupt the rest period to attempt any movement. Both the right and left segment should be tested using the same method. Click Start to begin the test. The system will inflate the sense cuff. When the graph displays a flat baseline for at least 2 seconds, the patient should begin dorsiflexions on the testing leg. Have the patient complete at least 5 dorsiflexions or more. Tell them to stop once the waveforms show that the blood has evacuated to the maximum level above the cuff. Upon completion of the dorsiflexions, the patient should rest with feet flat on the floor and no movement. Click the Stop button when the tracings have moved all the way off the left side of the screen. Next, adjust the tracing so that the dorsiflexion waveforms are fully visible on the left side of the screen. Your first click will be on the point in the tracing that represents the time at which the patient stopped all movement, where the southernmost point of the entire trace lies. After your first click, your second click will be at the point where the refill line first begins to plateau, or where the refill line crosses over the top red line. The refill time will be calculated and displayed on the test screen. Repeat these steps for the left leg. After the test is complete and you have exited to the test summary screen, select a read site and click the Test Signed box on the Test tab. Now you are ready to send the test to your interpreting specialist or reader via the seamless Biomedics Collaborative Care Network. From the home screen, click Send Receive and then click Send Sign Tests. The test has now been sent and will be returned soon. The reader will look for indications of disease and provide expert interpretation of the test. To retrieve interpreted tests, click Send Receive from the home screen and click Get Scored Tests. Then click Interpreted to display all interpreted studies. You can print the test by clicking the Report tab. Check the desired items and then click Print to send the document to the printer.